Thank you. Welcome to our premises. And let me just introduce our application of business intelligence. This session is fully dedicated to health big data, which is probably one of the most promising fields in our sector. The application of big data analytics in our field has a lot of different application that deals, of course, with artificial intelligence, with knowledge extraction, which means more or less to extract new knowledge from the data that we just have, and with advanced business intelligence that let us at national level, at regional level, at company level, to see in real time what's happened in order to change the clinical pathway of our patients, in order to let us provide better health care for them. Speaker of this session will show us important results in all of those fields. Let me introduce our business intelligence application, and just to give you some context about our hospital. As you probably know, Gemelli is one of the biggest hospitals in Italy. We have more or less 100,000 discharge per year, and with more than 50,000 oncologic patients, we are the biggest oncologic hospital in Italy. We are also involved in research because starting from 2018, the Italian Minister of Health recognized our scientific charter. And I want to underline this point because analytics and big data is one of the fields in which Gemelli is actually involved. So, just one point about our technology contest. Let me point just on one data. Our annual expenditure in medical device is around 85 million per year. So this is more or less the project background, because on one end, of course, as you can imagine, the availability of high-tech medical device is a strategic point in order to provide health care. But on the other end, due to public funding constraints, it's really difficult to have a balance between performance and cost. And that's why we think that business intelligence application can help us in doing something new and in understand how medical device change clinical pathway. Just to give you the three main pillars of our project, you have to know that all the medical device that we are using in operating room receive an RFID tag. So through a dedicated logistic, it's simple for us to associate the medical device to each surgeon that we perform. And the main idea is to develop a business intelligence program that help us in understand how the use of specific medical device can change clinical pathway. So, just to give you the information set that we treat, for each year of analysis, we correlate data coming from 90,000 discharge, more than 12 million of consultancies and exams that are performed during the patient stay in hospital, and more than 50,000 surgical procedures. So the information set that we try to manage with our BI application treats data that are coming from electronic health record, of course, with the information about DRGs, some benchmark data, the whole set of diagnoses and procedures that are performed on each patient, and data coming from other information systems like the operating room information system, our order entry for diagnostic exam and consultancies that are provided during length of stay of patients in hospital, and of course, as I just said, about the use of medical device during surgery. So, let me say that the main scope of the project is to understand, selecting a specific clinical scenario, how the medical devices are used in order to assess both economic and clinical analysis, in order to understand how we can change the medical device that we are using in order to balance cost and performance. Let me give you an example in order to let you understand the capability of the system. In this example, I will show you a particular use case scenario which deals with uterine neoplasm. Selecting a specific scenario, which means that these kind of patients have to receive more or less the same kind of treatment in hospital, we can see the total number of patients treated in a predefined time range, the stratification of input diagnosis and procedure performed, and the data about the hospitalization and length of stay in hospital, and at the end, the DRGs that we produced. Of course, you have to imagine that we can see these data in a real-time environment, which is more or less the best help that business intelligence could give us. For these patients, we can analyze all the medical devices that we use during surgery, and we can understand the difference between the habits of individual surgeons, which is a point that could give us some surprise, of course. Then, in order to have an economical assessment of the device, for each surgery that we deliver, we can calculate the revenues from DRGs and the costs related to the occupation of the operating room, the length of stay in hospital, and the length of stay in ward and in intensive care, and of course, the cost of the medical device used. To understand and investigate the effect of medical device on clinical pathway, we can analyze in a real-time environment the examination delivered to patients during the pre-admission phase, the hospitalization phase, and the follow-up phase. So, this means that at the end, we use this data in order to continuously change and reconfigure the kit that we give to surgeon during surgery in order to try to understand the best balance between cost and clinical performance, which is more or less one of our major game in these times. So, just to give you some short conclusion and let the other speakers show us the relevant result in this field. Big data analysis is really an important point, not only in research now, but treating big data could help us in better understand how we can balance cost and performance, because sometimes we have to note that the use of high-cost medical device can impact on clinical pathway in other measures that could be length of stay or other clinical procedures. Okay, and that's all.
Thank you so much, Giovanni. That was really interesting. I know you are in a rush, and thank you so much for finding some time to be here with us. If there is a very, very quick question, maybe we can take it. Otherwise, I thank you again very much, Giovanni.
Thank you.